But now we have a very special guest in studio. So we have been soaking up the sun all summer long, but what does that mean for your skin? Well, Dr. Cynthia Lavery Henry is here from Apex Skin with options on how we can repair sun damage. Dr. Henry, thank you so much for being here.
Thank you for having me.
All right, so we're talking sun damage. I've spent a lot of time outside this summer. My boys have spent time this summer, but you're saying that sun damage can really be dangerous.
Yes, unfortunately, it is the leading risk factor for skin cancer. So it is very important to be very careful in the sun. We can still enjoy the sun, but there are some things that are important, such as sun protective clothing, hats, wearing sunscreen SPF 30 or higher, and reapplying every 2 hours, which is a hard part to remember.
So it's kind of funny. I know my sister-in-law Leslie is watching right now, and she has a little boy. He's going to be 1 in September, Trip. And whenever she takes him out into the sun, we kind of joke around because she puts him in long sleeve shirts and shorts, and she lathers him up in the lotion. But she's actually doing a really good thing for him.
Absolutely, yes. Babies starting at 6 months, sunscreen is available to put on our children. Reapplying is really important. Those rash guard swim shirts are so helpful, so you don't have to put as much sunscreen on. They're actually more protective. So yeah, she's doing a great job.
So it's kind of funny. You don't really think about that when you're a kid or when you're a teenager. I remember being in high school, I'd go to the tanning beds and, you know, you just wanted to look nice and have a nice glow for that homecoming dance. But doing that actually kind of speeds up the aging process, doesn't it?
Yes, yeah, we know tanning beds are not good for your skin in any way. They're never recommended. They increase and accelerate fine lines and wrinkles and increase the risk of skin cancer quite a bit. So they're not necessary. And instead of that, what we're trying to do and tell our teens to do is to get spray tans, which are considered safe, to get those for special events like proms and so forth, and also wearing makeup that has bronzers and things that are also safe.
I can tell you, I personally switched over maybe 15 years ago, but I wish I had known now, or known then what I know now, just in terms of all the things that you can do to actually prevent, you know, skin aging. So what are some of the best tips and tricks you have for preventing skin damage?
Yeah, the first thing is photo protection. So whether that be sun avoidance, avoiding the sun during the midday sun, that's the strongest. So going out early in the morning, late in the afternoon and evenings is the best. Wearing sun protective hats, clothing, and sunscreen SPF 30 or higher. Those are the best things. Then there are some things that you can do to help repair some of the damage using different products, medical grade products such as retinols, even prescription retin-A type of medications. Also, antioxidants are very helpful for the skin.
One of the things that I recently started doing, a friend told me about it, they have an SPF lotion that's also a pigmented concealer. So it's lightweight, but you're also protecting your skin, even if you're just running errands outside, because they say even just getting out of your car, running into the store, you're still exposing your skin.
Yes, absolutely. So I recommend all my patients to wear their sunscreen on all exposed skin every morning, whether they think they're going to be out or not. The other area that I recommend putting sunscreen on every day would be the back of your hands.
Oh, I don't even see that.
Yeah, with driving and other things that we don't even think about, we're getting a lot of sun on there, and that can add to aging over time.
All right, so we've talked about the prevention. You briefly mentioned some of the treatments. What would you say is the best step that our viewers should take in terms of saying, like, okay, I've got some, you know, a sunspot right here. What do I do? How do I treat that?
Well, I would say go to your dermatologist, get full skin cancer screenings every year to make sure that there's nothing abnormal or anything that's real serious going on. And then in addition to that would be to get on a good medical grade regimen for your skin. So including cleansers, different products, such as I mentioned, the antioxidants, the retinols, so that you're getting a good ability to take care of the things that you've already damaged, but also work on things in the future.
Perfect. Dr. Henry, thank you so much. Apex Skin, you guys have 12 locations all throughout Northeast Ohio. You're at the Westlake office, right?
Correct.
All right, I'm going to have to make an appointment to see you soon. Thank you so, so much.
Thank you, Nicole.